Good evening. Thank you for joining in this at such a short notice. So, community medicine questions were around 30 questions is what I heard. I'm not very sure, 30 or maybe more than that, and I could collect around 26, 27 questions. And most of the questions were from communicable diseases. And first of all, let me tell you, all these are questions which were recollected from many of the students, and thank you very much. I really thank everyone who has helped me to recollect all the questions. So naturally, all these, there may be some ambiguous things that you may come across when I read these questions, because these are not pakka questions. And majority, as I said, were from communicable diseases, and two questions I could get from statistics, then 2-3 from epidemiology, then from non-communicable diseases, and some miscellaneous questions. So let's start with the first one. And please feel free to ask me any doubt if you have in between. But, it's, if possible, you can write it down and you can keep it to the end. And like I said, I'll definitely finish off in 1 hour. So let's start. We'll start with the first one. Okay, since statistics is something which is looked upon as a very boring and very difficult to understand topic, I thought I'll start with the statistics, just in case you are, scooting in between. I can at least finish off the statistics part. So the first question was, increased confidence interval is attained by which of the following? Any answers? You can unmute and tell me. That would be fine. Yeah, yes, definitely. It will be good for FMGE as well. Anyone? Come on, guys. This is the problem. I have to see the chat. You can unmute, no? Okay, so increased confidence interval is attained by which of the following? So first, let's see. See, the options are decrease sample size, increase sample size, increase confidence interval, increase variability. Let me tell you, this is a repeated question. That is the first thing that you have to keep in mind. And every time the answer has been the same. So let's see what is the answer here. By the way, what is confidence interval? First, MCQ, the formula itself is a MCQ. It is mean plus or minus 2 standard error, right? Now let's see what is the formula for standard error. Standard error is, that is the next MCQ. It is standard deviation divided by square root of sample size. So naturally, look at the sample size. Two options were from sample size, right? And sample size is coming in the denominator part. So they are inversely related, right? They are inversely related. So as the sample size increases, what happens? The confidence interval decreases. And as the sample size decreases, the confidence interval increases. So the question was, when does a confidence interval increases? So when sample size decreases. Okay, so there the answer is A. But see, look at the other options. This is A is correct. Increased sample size will decrease the confidence interval. See, as far as, from the recollected question, 2-3 students said it was increased confidence interval, but I don't think that might be the option there. See, increased confidence interval is attained by which of the following? Again, increased confidence intervals. So I think there is some ambiguity in that option. And what about increased variability? See, this is also something that you have to keep in your mind. As variability increases, by the way, what do you mean variability? As the values in the sample increases, or as they vary, as they differ, standard deviation increases. As variability increases, standard deviation increases. So as standard deviation increases, what happens? Again, the standard error increases, and 95% confidence interval will also increase. So I would like to tell you, this is also a correct answer, because students had told me that in many questions, the answers were like A and B, choose 2, choose 3. So if you had something like that, and if the question had been like choose 2, then you have to go for A and B. Otherwise, go for A alone. Is that clear? So we have 2 answers. One is A and D. Both are answers. If you are asked to choose one, go for A alone, because this is the correct answer. Hope you're with me. Okay. Moving on to the second MCQ from statistics. This time only 2 MCQs from statistics. Method to describe the collection of data can be included under analytic, theoretic, descriptive, and inferential. So what is it? It's there in that question itself. You describe collected data in descriptive statistics. So what is descriptive statistics? Now let's see one by one. Descriptive means, first question, As the name indicates, you are describing the data. For example, you took a sample of 100 COVID patients and you are simply describing like 40% were females, 60% were males, 20% were elderly. Likewise, you are simply describing. That is descriptive statistics, which is the correct answer here. Okay. Now, what is analytical statistics? Here, you are going one step further and you are comparing. Again, each of this you can expect as an MCQ. Okay, you are comparing and you are trying to find out A and A. You can remember like this. You are looking for the association. You are comparing and you are looking for the association. Like, is there any relationship between elderly and complication? Is there any relationship between those who have comorbidity and the complication or death or mortality in COVID patients? So you're looking for association in analytical. Is it clear? So A and A, that way you can remember. Now, what is inferential statistics? As the name indicates, inferential means you are inferring the result that you got from the sample to the whole of population. That means the result that you got from these 100 COVID patients, you are trying to infer that to all those patients with COVID out there. Okay, so that is inferential statistics. That means you are trying to interpret the result to the whole population outside. Is it clear? And theoretical statistics, that was just a, that was just a distractor for you. Forget about it. That's not at all important. Whereas all these are important. So the answer here is C. Okay, moving on to the next. Next 3 questions were from screening. Seriously, 3 questions from screening. Routine screening is cost effective and is recommended in which of the following? I was expecting you guys to answer. You're simply sitting. What is the answer? What did you write? B. Okay. B. Sure. Was it B? Routine screening is cost effective is the question. See, cost effective. Which one is cost effective? In these 4, it is GDM. GDM is cost effective. If you're asked to pick one, then go for GDM. Okay, because in GDM, it is cost effective. Whereas echo is not cost effective. And if you're asked to pick 2, then you can also go for VDRL. VDRL is for syphilis, right? You do it for syphilis. In antenatals, we are routinely recommending it. That doesn't mean that this is very cost effective, because in a resource constrained setting like India, where syphilis is not that much prevalent, I don't think it is cost effective, because many studies are showing that it is not cost effective. So if you're asked to choose one, then the answer would be A. And if you're asked to choose
for GDM,
gestational diabetes mellitus, I'm unable to hear you.
GDM full form, ma'am.
Gestational diabetes mellitus.
Yeah, okay, ma'am. Okay, ma'am.
Okay, so that is the answer. I thought you guys know it. It's something that we always use, no? GDM. So VDRL, that you know, right? That is done for syphilis. And in India, not only in India, even outside, we do routinely, especially in India, we routinely screen antenatals for VDRL, HIV, HPSAG, all these things that we are doing, right? Whereas syphilis is not that prevalent in India. So the studies are showing that it is not that much cost effective like GDM. So if you're asked my doubt, what I want to tell you is, if you're asked to pick one, then go for GDM alone. Okay, A. And if you're asked to pick 2, because there were questions like pick 2, that is what I heard from students, then you can also go for C. I hope I'm clear. Okay, so we are done with the 3rd question. I said there were 3 questions from screening. The second question from screening was, in India, pre-transfusion screening is recommended for all except. It is done for HIV, it is done for HPV, it is done for malaria, it is also done for HCV. That means hepatitis B, hepatitis C, HIV, and malaria. These are the 4, you call them as TTIs. That is the next MCQ. TTIs. That means transfusion transmissible infections, or transfusion transmitted infections. So we have 4 TTIs. Transfusion, I repeat, transfusion transmitted infections, which are HCV, HIV, HPV, and malaria. So dengue is not included in TTIs. So which is the one that is not recommended for screening? That is dengue. Okay, so here the answer is D. Okay, shall I move on to the next? Which of the following regarding genetic screening is true? That is the next question. Regarding genetic screening, which is true? Option A. Screening test defines risk of passing genetic disorder. What do you think? Yeah, that is true. When you do a genetic screening, that will tell you whether you have the disease as well as what is your risk of passing it to the next generation. Okay, or your risk of passing it. Screening are more accurate than diagnostic tests. What do you think? Not only in genetic, you take any disease. Screening is less accurate than diagnostic test, right? After doing screening, if someone is found to be positive, then you go for some diagnostic test, right? So always, screening is less accurate and less invasive. So that comes the third one. Usually involves invasive procedures. No, usually they involve less invasive procedure. How do you do genetic screening? Either by taking a hair or sometimes by taking your, scraping from mucosa, scraping from skin, sometimes blood. All screening. Okay, every screening, you have to, if to call something as screening, it has to be less invasive, usually. Okay, so, and screening requires genetic mapping. No, not all screening requires genetic mapping. So, which is true? Here only one is true, that is A. It defines your risk of passing the genetic disorder. It is more accurate. No, it is less accurate. It is involves invasive. No, it usually involves less invasive procedure and it does not require genetic mapping. Okay, hope I'm clear. Is that okay? Fifth one. Shall I move on to the next? Say something.
Okay, ma'am.
Okay. And the sixth one was, which of the following regarding Human Genome Project is true? I heard there were two answers here. You were asked to pick two. I'm not going into the details. Let's see one by one. So we can expect a similar question in the future as well. Human Genome Project, which is true. More than 20,500 genes were identified. That is true. More than 20,500 genes were identified. They uses next generation sequencing. No, they don't use next generation sequencing. They are using some other mapping technique. Next generation sequencing is something hi-fi that came little later after we started doing the Human Genome Project. Actually, this was started in the year 1988. It's an old one. Okay. This was conceived in 1988 and they started working in 1990. So after that, only this next generation sequencing was done. So this is wrong. It is done with international collaboration. Yes, this was done with a lot of international collaboration. Without that, you can't do a Human Genome Project. You need the cooperation from a lot of countries. Took more than 2 decades to complete. No, this was completed in 13 years. This was completed in 13 years. So we have only two answers which are correct, A and C. Okay. So correct is, true is A and C. Next question. Next two questions are from immunization. One is from child immunization and the next was from elderly immunization. Okay. 1 year old child's mother comes to your immunization clinic telling that the child received first dose of pentavalent, which was taken at 6 weeks. What is your plan? That means the child has taken 1 dose of pentavalent at 6th week. After that, no more follow-up. After 1 year, the child is again coming back. So what will you give? Give second dose of DPT, give DT, start a fresh cycle of DPT as a first dose, give second dose of pentavalent. This I really want to hear from you. Anyone? Because in class, in integrated sessions, in quick learning bites, in many sessions, I kept on telling this thing. So I want to know. Money. Yes. Thank God. You're right. So all those efforts didn't go in vain. I'm so happy. You're right. See, the point is, the child has taken the first dose. See, when it comes to pentavalent, I'm not going into the details of pentavalent. Please do remember that pentavalent, rota, these are the MCQs. Okay, penta, Rota, and IPV. These are supposed to be given only up till 1 year. Only up to 1 year. Beyond 1 year, if an unimmunized child is coming, you don't give these vaccines. Instead of Penta, you have to give DPT. But the point is, I have clearly told you this point. If the child has already started taking any of these vaccines in the first 1 year, but forgot to take the rest, and after 1 year, he or she is again coming back to the hospital, then you have to continue giving those vaccines. That means here the child has taken the first pentavalent vaccine, right? So what you need to do is, even if the child is coming after 1 year, you continue the dose. So the answer is give the second dose of Penta and you complete the dosage. Hope I am clear. Second dose DPT, quick learn bite help. Okay, Raja, very happy to know that. Okay, because I was seriously expecting this question. That is why I kept on giving this particular point, and it really helped. Next is immunization for elderly. Child over elderly. Immunization for elderly is recommended for influenza vaccine, that we all know. Which of the following other vaccine preventable disease is given for elderly? Anybody? Diphtheria, meningococci, rotavirus. Rotavirus, so you can just like that rule out, right? And zoster. Which one? What is the answer? Come on. What is the answer? Nobody's responding. Meningococci, no money. Meningococci, we give for exactly. It is D. D. B and D. No. It's D actually. You know why? See, with diphtheria, we don't usually recommend for elderly. Rotavirus also, we don't recommend for elderly. Now, I think you have a doubt regarding meningococci. We give meningococci under certain situations only. Okay, meningococci we give for those who are traveling abroad, like, Hajj travelers, then those people who have undergone splenectomy. So under certain conditions only, you give meningococci. You don't routinely give it for elderly. Whereas zoster is routinely given as per CDC recommendation. Herpes zoster vaccine should be given for those who are more than 60 years old. I've taken a class on this. Okay. More than 60 years old, and it is given as a single dose. So please keep that in your mind. Meningococci, no, you are not giving as a routine vaccine, single dose. Let me check the time. Okay. So the answer is herpes zoster. Raja, I hope it's clear. No, don't get confused. It's not B and D, it's just D. Next question. Now we are moving on to the communicable disease session. Many questions were quite expected only. We had actually 2 questions from leprosy. This is regarding the latest guideline of leprosy. Leprosy contacts for PEP, which are correct. By the way, what is PEP? Post-exposure prophylaxis. So in our National Leprosy Eradication Program, they have clearly said who all will be coming under the criteria of contact, so that you can give post-exposure prophylaxis. So let's see which among this is correct. Age less than 2 years. No. It is said that PEP is given only for those who are more than 2 years. So in the program, the PEP recommendation is for a person who is more than 2 years. So that is wrong. Living in contact with the patient for more than 6 months. No. It is living in contact with a patient for more than 3 months is what they have recommended in the guideline. Living in contact with patient for more than 20 hours a week. That is the correct answer. Okay. Living in contact with the patient for more than 20 hours a week for 3 months in the last 1 year. I'll show you those guidelines. Sharing clothes, towels, and with the patients, those are not the criteria. Now let's see which are the criteria. I'll show you the criteria for post-exposure prophylaxis. So in leprosy, to whom all will you give post-exposure prophylaxis? First, in contact for more than 3 months. See, in that question, it was 6 months, right? More than 3 months, 20 hours per week with the newly detected leprosy case in the last 1 year. That is the first criteria. Second, age should be more than 2 years. Just Keep these two things in your mind. Now, the next MCQ that you can expect is, since they have started off with the criteria, next in Neet or in FMGE, they will be asking for, so which are the drugs that you give? A person who is coming in so and so criteria, which are the drugs that you give? So for post-exposure prophylaxis, we are giving just one drug, which is that in leprosy. Anyone? There is no point in waiting, it seems. Anyway, single dose rifampicin. Okay, you're giving just one dose of rifampicin. That's it for leprosy. Okay, so there is no need to be scary if you come in contact with a leprosy patient. Just single dose of rifampicin will do. And if you are more than 35 years, 600 milligram. That is a standard dose that we normally give, right? For 20 to 35 years, it is 450 milligram. So this is the next set of questions that you can expect. Again, as MCQ you can expect, because the first part has been asked already. And a person who is less than 20 years, it is 10 to 15 milligram per kilogram body weight. So this is rifampicin. So please keep in your mind, for leprosy contacts, we are giving single dose rifampicin. Very, very important. Very important. So this MCQ you learn now. Okay, so here the answer is C, right? No doubt about it. Next was really confusing question. Okay, you may think, oh, it's so simple, and you must have answered it thinking that it's so simple. But when I talk to students, many had got it wrong. A patient comes to you with a single hyperpigmented hypoaesthetic plaque with thickened feeder nerve. What's the management protocol for this patient? And the images of paucibacillary and multibacillary drug kits were given, right? Now, what answer did you write? So many are there, but when I ask, nobody is responding. You can at least write, you can chat. You wrote D, B for 12 months. See, why I said it as confusing as what is given in your guides and what is given, what we do in program are different. What is given in your guides is the WHO criteria. It's the latest WHO criteria. That is what is given in your guides, is latest WHO criteria. As per the latest WHO criteria, it is said that for paucibacillary, now please remember, this is very important. Okay, by the way, this patient is coming under paucibacillary, right? 1 to 5 lesions. Paucibacillary. So in WHO, they say for paucibacillary and multibacillary, you are giving 3 drug regimen. This is WHO criteria. You're giving 3 drug regimen. You know which are those 3 drugs. You are giving rifampicin, dapsone, and clofazimine. The only difference is that in WHO, the guideline, the only difference is that in paucibacillary, you are giving the same 3 drug regimen for 6 months, whereas in multibacillary, you are giving it for 12 months. This is what the WHO guideline says. Okay. Whereas as per the NLEP, that means the program we have, you have to follow what is given in your PARC textbook. Because in PARC textbook, it's all about what we are following in field. And in field, what we do was, for paucibacillary and multibacillary, we are giving different regimen. For pauci, we are giving 2 drug regimen. I'll show you the picture. See, this is from the latest. Can you see? Latest, September 2021 guideline, which was given in NLEP. That means National Leprosy Eradication Program. Can you see? See, this is the logo of NLEP, which was again a previous MCQ. Okay, logo of NLEP. And for paucibacillary, we are giving just 2 drugs, rifampicin and dapsone. It is coming in green pouch, right? Whereas for multibacillary, you are giving 3 drug regimen, that is rifampicin, clofazimine, and dapsone, which is coming in red. Okay, and this is given for 6 months, and this is given for 3 months. So what is the answer? Here, they haven't mentioned about, see, they haven't said anywhere that they're asking as per the WHO. It's simply what you're following in India. So what are you following in India? In India, see, for paucibacillary, you are giving this green, which was marked as A, right? For 6 months. Since this is a case of paucibacillary. And just in case you are interested to see the color of the boxes that we are giving for children under NLEP, can you see? This is kind of white, and for multibacillary, this is kind of yellow to orange, I would say. Okay, not exactly yellow to orange. That is the color that you give. Okay, so all these you can expect as image-based question because these drug kits were previous image-based questions. Okay, so when it comes to this question, what is the answer? You're giving A for 6 months. Hope I am clear. I myself have read in many of your books that, yeah, one nerve was involved. Yeah, one nerve was involved. That means that becomes paucibacillary, right? So for paucibacillary, you are giving this green kit for 6 months. Is that clear? If you're thinking about a ROM regimen, no, we are not using ROM regimen in the field. In field, we are giving green and red. Okay, moving on to the next. So we are done with 10. Admission to airborne, there's nothing much to discuss here. Admission to an airborne infection isolation room is advised for which of the following disease? You can tell me, fatafat. Just like that, you will tell me. What is the answer? Which among this is airborne? That is the question. Which among this is airborne? So simple. You can't go wrong here. However you try, you can't get this question wrong. Which one is airborne? It is measles, right? What about Nipah? Is it airborne? It's not exactly airborne. It is fomite and droplet. CJD. CJD is it is a encephalopathy. There is no person-to-person transmission. And then aseptic meningitis. When it comes to aseptic meningitis, see, Nipah virus from bat. What are you asking, Mani? Nipah virus from bat. Yeah. From bat, again, it is not airborne. See, by the way, we haven't proved that it is airborne from bats. It is again droplet infection. You are getting the secretions. Are you understanding? There is some difference between droplet, fomite, secretion, airborne. So from bat, it's very rare to get it from bat. Even if you get it from bat, it is airborne. It's not airborne, but it is through droplet and other forms. Okay. And aseptic, when it comes to aseptic meningitis, again, some viral, it is said that few viral aseptic meningitis can be transmitted, but it's not proved. So only disease where airborne transmission is proved is measles, whereas all others are wrong. So here you have only one answer, that is measles. Hope I am clear. Next question. HIV prophylaxis in a neonate of an HIV positive mother. I didn't get the options here. I asked the students, but they said, Madam, it was a lengthy question. We can't recollect the answers. We can't recollect the options. So anyway, I don't know what were the other options. Anyway, I've given the correct answer here. A mother is HIV positive. A baby, a neonate is born. How long will you give nevirapine? This was one of the options. Give nevirapine daily for 6 weeks. Yes. Now let's see what are the other MCQs from this particular thing. Vivek, by the way, there's a multiple question, ma'am. Which one are you saying? Which one are you mentioning, Vivek? Okay, we'll come to you. I'll come to you. Okay. I think I missed your when you typed. I missed that. Now I don't know which is the question that you are mentioning. Now let's see. Nevirapine is given for 6 weeks. Next MCQ. What is the dose? It is given as 2 milligram per kg. Okay. After 6 weeks, will you give it? See, after 6 weeks, what you do is children or a baby who's born to an HIV positive mother, after 6 weeks can undergo early infant diagnosis. Early infant diagnosis, also known as EID. Okay. And this early infant diagnosis, that means as early as 6 weeks, the child can undergo diagnosis to know whether he or she is infected. And which is that early infant diagnostic test? That is the next MCQ. It is dry dot test, which is a DNA PCR technique. Read this as P. Okay. I'm not good in using these gadgets. It's a DNA PCR technique which can diagnose babies as early as 6 weeks. And if the child is found to be positive at the end of 6 weeks, see, this is given as prophylaxis. If the baby is found to be positive at the end of 6 weeks, then you have to start pediatric ART and not nevirapine. Hope I am clear. So it is given up to 6 weeks usually. After that, as per the diagnosis, you can either give pediatric ART, okay, or you can stop. Is that clear? And okay, I'm not going into the rest of the details. See, after 6 weeks, you can also start the child on CPT. That means called trimmoxis or prophylaxis therapy. Anyway, those details are not needed now. So I have said about all that in the class. So these are the MCQs that you have to remember. Here the answer was give nevirapine daily for 6 weeks. Now I don't know what were the other options. I hope you have got a lot of MCQs from this particular MCQ. True statement regarding the measure of typhoid control. This you will definitely answer. First question. Immunization is the most important measure. Immunization is important, but do you think it is the most important measure in typhoid? No. This is important, but not the most. No. Safe disposal of human excreta, safe water supply, and personal hygiene is the most important strategy than immunization. Yes. That is why most of the developed countries don't have this typhoid, whereas countries like India, and some developing countries, they still have typhoid, where they have open defecation and all those unhygienic measures are, or I would say lack of sanitation is existing. Drug resistance in typhoid is not as big as TB. What do you think? No, that is also wrong. Drug resistance in typhoid is also something which is very important. Just like you have in TB, in typhoid also, see, in typhoid also you have XDR typhoid. You have MDR typhoid. I'm not going to tell you what it is since I've said all these terms. Go back and refer. Okay. So what I want to tell you is drug resistance is very important in typhoid as well. What about C? Person-to-person transmission is present in 10% of cases. There is person-to-person transmission. In no book have they given this 10%. In most of the books, they have given it beyond 10%. It's more than 10%. So this is also not the answer. So we have only one answer here, which is B. Safe disposal is the most safe disposal of excreta, safe water, personal hygiene. All these are the most important hygiene, most important strategy that you have to take up for preventing typhoid. Going on to 14th question. A 50-year-old male presents to you with fever for 3 weeks duration. Antibiotic and antimalarials did not work. Abdomen distension is present. That means the patient has abdominal distension is present. That means the patient has hepatosplenomegaly. Keep that in your mind. Then RK39 dipstick test is positive. What will be your management? By the way, which is the disease? There are two clues towards which the disease is. One is abdominal distension. That means sometimes splenomegaly or hepatomegaly, and RK39. In which disease do you three RK39? Anyone? RK39 is seen in? Come on. In which one? It is seen in? Correct. Very good. It is leishmaniasis. Visceral. Very good. Excellent. So you might have got the answer correct, I guess. Now let's see the other MCQs from visceral leishmaniasis, which is very important. It is also known as Kala Azar. You know that. Why it is known as Kala? Because there is a blackish discoloration and it was first discovered in India. So it got that name, Kala. Kala Azar. Blackish Azar. Also known as black fever. It is also known as black fever. That was also a previous MCQ, also known as black fever, which I think you won't miss. Black fever. Black death is plague. Okay. Black death is plague. Black fever is Kala Azar. And like it is mentioned in the question, you get fever, anemia, weight loss, enlargement of spleen and liver, and if untreated, it can be fatal. In developing countries, this mostly exists in developing countries like India because we have a lot of undernutrition, HIV, and immunocompromised conditions. Now, the next MCQ was, this was a previous image-based question. Can anyone tell me what it is? I hope you are seeing it now. A previous MCQ from leishmaniasis, which was an image-based question. What is this? Very good, Raja. PKDL. What is it? Post-Kala-Azar dermal leishmaniasis. This is post-Kala-Azar dermal leishmaniasis. Keep this picture in your mind. You can expect this as an MCQ, which has come already. Now the test. I'm not going to tell you what these tests are, but there are 3 named tests like RK39, recombinant K39 protein. It's a rapid diagnostic test kit, which will give you result in just 5 minutes. Okay. So this, when you see these names, always think about this leishmaniasis. One is RK39. Second name is given in your PARC textbook. You can go back and refer what these tests are. Napier's aldehyde test. And the third is Montenegro skin test or leishmaniasis skin test. Whenever you see these names in the question, like RK39, don't think twice, go for leishmaniasis and answer. So which are the treatment that which are the treatment regimens we have? One is LAMP, liposomal amphotericin B injection, which is given as IV. And in program, we are giving one capsule starting with M, which is miltefosine capsule. This was a previous MCQ. In program, which is the capsule, which is a tablet, or which is the oral drug. That was a question. Which is the oral drug given for leishmaniasis in India as per the program? That is miltefosine. And 2 more other drugs are there, antimony and then paramomycin. So the ones important are amphotericin and miltefosine. And the answer here was amphotericin B, which I am almost sure everyone got it correct. Coming to 15. What is the time? Yeah, we have little more time left. Definitely we'll finish off within 9 o'clock, like I promised. A 23-year-old male with history of fever and chills. You have to see the patient in your mind, okay? 23-year-old male with history of fever with chills and rigor for 6 days and altered mental status for 1 day. RDT, PF was positive. Which of the following is not a complication of the same? So what is the diagnosis? PF positive. That means it's a Plasmodium falciparum malaria, right? Plasmodium falciparum malaria. And the patient is having altered sensorium. That means it is cerebral malaria. It has gone up to his brain. It is cerebral malaria and the patient is going for complications. So the question is, which of the following is not a complication that is mentioned under severe malaria? Yes, you're right. All of you are right. RBS less than 40 milligram. It is hypoglycemia. So hypoglycemia is an expected, this is correct. Hypoglycemia is an expected complication of severe malaria. Unerosible coma. Yes, the patient can go for coma. That is also something that we are expecting in cerebral malaria. Serum creatinine 5.2. That means the patient has gone for, or his kidneys are compromised. So again, something that we are, renal failure. That is expected. Now, what about why you said D is wrong? We are expecting metabolic acidosis, right? It is metabolic acidosis, whereas what they have given here is alkalosis. So this we don't expect. So what the answer here is D. And for those who are interested to know which are the complications, it's given in your PARC textbook. See, I'm not going to read all this. Since you're watching, you can go through this. It's given in your PARC textbook in a table, which are the complications that you see in severe malaria. And this particular question is taken from that table alone. Okay, so please go back and read. See, metabolic acidosis. No, what they have given is metabolic alkalosis. So this is what you expect and not alkalosis. Hope I'm clear. So let's not waste any more time on this. And others also, please see all other, there are 12 complications mentioned. So go through all those 12. Identify the patient with appropriate profile for chronic hepatitis B. The parameters included where? This is also a question from a table given in your PARC textbook as well as in Harrison. Same table they have given in both PARC textbook and Harrison. And I'll show you the table. This is the table. What you see here is the table. Same table you will find in Harrison as well. So the question is, If a patient is having chronic hepatitis B, which all parameters you can find? So, which all parameters you will find? This is a case of chronic, this is chronic, this is chronic. So, in chronic, since you have a table, you can go back and read. Due to lack of time, I'm not going to discuss this table. Please do understand that HPS AG can be present, anti-HPS AG can be present, anti-HPC can be present, but you find this not in chronic, but in early stage. HPV DNA is usually found in the early stage, whereas in chronic cases, a patient may have HPS AG, sometimes anti-HPS AG, and then anti-HPC as well. So just go back to that table and read it. It's given in your Park textbook, and Harrison, I am repeating. Okay, you have to read it. Another one, okay, just one point I want to discuss from this table, which was a previous MCQ. In vaccination attained immunity, which one will you find? Which all among all these blood parameters, which one will you see if a person is vaccinated with hepatitis B? This one, anti-HPS is what you find in a person. That alone you will find in a person who is vaccinated with hepatitis B. This was a previous MCQ. Now they have started asking from the rest of the rows as well. So the answer A, B, and C all are correct. So the following will you find was the question. Now coming to the 17th question. As per NTEP, high priority TB HIV district is defined as. Did anyone give it correct? Has anyone given the answer correct? Even if you didn't get this correct, it's okay, because this was an unexpected question. Usually you get a lot of left. Good. Okay. Because, they give 2-3 tough questions which they don't expect you to answer. If everyone answer every question correctly, then how will they, it's a competition exam, right? So definitely they'll give 2-3 very, very difficult question, and this is something like that. And here the correct answer is A. As per NTEP, National TB Elimination Program, high priority, that program itself is new. Okay. And they are asking some numbers from that program. High priority TB HIV district is a district where high priority TB district is a district where more than 10% of TB patients have HIV. Okay. And I'll show you the table. This table is not given in your book, so you can keep this table in your mind. I don't know whether I think this will be available in YouTube. I mean, what I meant is this session will be available, I guess, in YouTube, or else you can take a picture now. Because here, there are 3 MCQs. High risk district for TB. This is a number. If TB notification rate is more than 180 per 1 lakh population, that means per 1 lakh population, if more than 180 cases are coming, that is a high risk district for TB. High risk district for HIV TB is among TB patients, if more than 10% are having HIV, then it is high risk TB HIV district. That was the question which came. So you can expect next time either this or this. So what is the third one? High risk drug resistant TB. What is the definition? If more than 25% of relapse cases, more than 25. So here it is 25. The other one was 10. If more than 25% of relapse cases are occurring in newly detected cases, then that is high risk DRTB. Okay. So I think since they have started with this, next time they may be thinking to ask something from either this or this. So keep those numbers as well in your mind. Now let's move on to the next one. Which of the following regarding rabies immunoglobulin is wrong? So simple. Which is wrong? If you have ever come to our department and if you have ever sat in, yeah, you're right. Raja, you're right. If you have ever sat in the OP, you will definitely get this answer correct. Okay, so you seem to have sat a lot in community medicine OPs. Okay, which of the following is wrong? Maximum dose of immunoglobulin must be given at the deltoid. What do you think? Immunoglobulin, passive immunity. Where do you give it? Maximum in and around the wound. Wherever there is wound, you give it in and around, and you're trying to neutralize the virus, right? So you have to give it in and around the wound. Exactly. Correct. Around the wound. IM doses 20 international unit per kilogram. That is correct. For human immunoglobulin, it is correct. Whereas for equine, we have one more, which is equine. For that, double. That is 40 international unit per kilogram. Each and everything I write is an MCQ. Keep that in your mind. Huh? Not given after 7 days of first dose. What do you think? By the way, for whom do you give immunoglobulin? Immunoglobulin is given for category 3 patients, right? It is given for category 3 patients. Now, who are category 3 patients? High-risk patients. For them, along with vaccination, you are also giving immunoglobulin. May you know why? May I know why? See, and this vaccines, you are giving 0, IDRV, you are giving as 0, 3, 7, 28, right? That is what you give as IDRV. For IM, you have one more, which is, okay, what happened? Now, for IM, you have one more, which is 40. Anyway, these are the primary doses. And once you give these 3 doses, it will take some time for immunity or antibodies to develop. By that time, the problem is if the patient is a high-risk patient or if the patient has got a high-risk bite or high-risk exposure, by that time, that means by the time the antibodies will slowly start developing, this virus would have ascended and it will easily reach the brain, giving rabies disease to the patient, right? So you can't wait in high-risk patients. So what you do is, along with this vaccine, you should also give antibody from outside, which is immunoglobulin. Okay, so you are giving double protection. Along with the vaccine, you're also giving immunoglobulin. But the thing is, by the time you give 037, the patient would have developed all the active immunity. Then is there any role for passive? No. So a person who has already taken the first 3 doses, that means 037, active will be very much active. Then you don't have to give immunoglobulin beyond that. Hope I am clear. That is why this is also correct. This is correct. Human rig, if not available, give purified equine immunoglobulin. Yes, human is the best, but government can't give human free of cost. It is not available in most of the hospitals. So what we have is equine rabies immunoglobulin. So this is also correct. So here the answer is, which is wrong, right? Which is wrong? A is wrong. Okay. So we have covered a lot of MCQs in this. Endogenous transmission in India is reported 4. Come on, tell me. Only one is available in India. Which one? As you all know, yellow fever. No yellow fever. We don't have any yellow fever, right? What about CCHF? What's the answer? CCHF in Karnataka. Raja, not only in Karnataka, this has already come in Gujarat, in Orissa, in many places. It was first reported, if I remember correctly, it was in 2011. The first outbreak was reported in Gujarat in 2011. Since then, in many places, we are getting it. Ebola. What do you think, Ebola? Ebola is reported, but not yet confirmed. 1 or 2 Ebola cases were reported, but when we followed up, those were not actually Ebola. And Hendra is also not reported in India. So only one that is reported is CCHF. So here the answer is B. Okay, moving on to 20. Question number 20. High-risk HPV is indicated in all of the following. Oh, sorry, in which of the following? In which of the following? See, we have HPV 2 types, right? A, B, C. Sure. See, we have 2 types of HPV. One is high risk and low risk. Let's see the MCQs first. Low risk are 6, 11, 42, 43, 44. 6, 11, that you know. We have 3 more, 42, usually 42, 43, 44. Whereas high risk, a lot. Now, what about low risk? Low risk usually don't cause much of a disease except some warts, warts around the genital, anus, mouth, or throat. And low risk HPV, throat, mouth, and such places, right? Low risk HPV is the one that usually causes laryngeal papillomatosis. That is the D. is usually caused by low risk. Whereas the high risk ones, 14 numbered ones, 16, 18, 31, okay, you can read this. There are 14. All these are high risk. And out of these are the most important ones. 16 and 18 are responsible for most of the HPV-related cancers. And high-risk ones are the ones that causes, or high-risk HPV are the ones which causes the first three that were mentioned in the, sorry, where is it? Okay, I have to go back. These three are caused by high-risk HPV. That means anal cancer, cervical carcinoma, that means CA cervix, CA anus, oropharyngeal carcinoma, all these are caused by high risk. But whereas this one is caused by low risk. But it is also said that there are cases where high risk can also cause laryngeal papillomatosis. Okay. High risk can also cause. So please listen carefully. Laryngeal papillomatosis is usually caused by low risk HPV, but high risk can also cause laryngeal papillomatosis. So what is the answer? So I think the answer has to be all here, because all these four can be caused by high risk. Is it clear? So here the answer is all. Okay. Question number 21. See, there were two questions from HPV this time. One was regarding HPV viruses. Second was regarding HPV vaccine. This also I have taken in class in as an integrated session, and I think in many places I have taken this. HPV vaccine in the age group below 14 years is given as, come on, tell me. 1 dose, 2 dose, 3 dose, 4 doses. How many? One option was 1 or 2 doses. Oh, one option was 1 or 2 doses. You can't give it as 1 for sure. Anyway, I don't know whether that option was there. Since you said that might be one of the options, 1 or 2 doses, but okay, maybe it's not single. 1 or, okay, 2 doses. I have changed it as per what you have said, 1 or 2 doses. So what is the answer? Is that the answer? It is given as 2 doses. The point is, in less than 14 years, you are giving it as 2 doses, whereas in more than 14 years, you are giving it as 3 doses. Both are MCQs. Now let's see more about HPV vaccine. I've already taken this in class. You know, we have 3 types of HPV vaccine. You have bivalent, quadrivalent, and nonavalent. Let me make it very clear. At present, we are only using nonavalent because others have been taken out. What we use now is nonavalent. Gardasil 9 is what we use. And this also we have discussed in class, which are the 9 serotypes of HPV which are included. This itself was an MCQ. If I remember correctly, the MCQ was all the following except one are the serotypes which are found in nonavalent vaccine. And the answer during that time was 32. See, 31 is there, 33 is there, but no 32. So in that particular question, 32 was the answer. Which among the following is not present in nonavalent 9? So what I want to tell you is these are important. Okay, which are the serotypes that are present in Gardasil 9 or nonavalent? It's given for both males and females, but because we have seen that it is not only for preventing CA cervix, it can also prevent oropharyngeal carcinoma, then anorectal, so many things. So it can be given for both males and females. Now coming to the answer for that particular question. This is usually given for the age group 9 to 26 years, which is again divided into 9 to 14 years and 15 to 26 years. For those coming between 9 to 14 years, it is given as 2 doses of 0, 6. Whereas for those who are above 14 years, that means from 15 to 26, it is given as 3 doses. Like you give hepatitis B vaccine. How do you give hepatitis B vaccine? That everyone knows. 016, right? Here also you give it as 016. Okay. So this is how you give HPV vaccine. And one more thing, if that if you're giving it for someone who's immunocompromised, then you have to give it as 3-dose vaccine, irrespective of the age. Hope I'm clear. So for less than 14, 2, more than 14, 3, for immunocompromised, again 3. Each of this is an MCQ. Okay. Shall I move on to the next? Okay. Question number 22. Again from non-communicable diseases. So from non-communicable diseases, this time they have asked about malignancies, then diabetes. This is a question from diabetes. Mrs. X. Plasma glucose level is 160. What will you advise regarding the non-pharmacological management of the disease? What did you write? The plasma glucose level is 160. Let's assume that it was fasting. So naturally, this is a case of diabetes. Let's assume this is a case of diabetes because they're asking about diabetes only. And 160 is not that much of a higher value. So this might be a newly detected case, and they haven't mentioned that this person has any complications. So this is an uncomplicated case of diabetes because they haven't mentioned about any complication, and the value is also not that big. So which are the non-pharmacological management? That means apart from medicines, what all other things will you advise regarding the dietary modifications to this patient? Non-pharmacological also includes exercise, but here it is mainly about the diet. Not more than 30 calories should come from fat. That is correct. That is something that you have to clearly tell them. Okay, that means calorie should be less than calorie. 30% of calorie should be less than 30% of calorie only should come from fat. What about the next? Sodium, that means salt, should be less than 5 grams. That is also correct. That is also something that you have to tell them. Your salt content should not go beyond 5 grams or 500 milligrams. Diet with less than 100 milligram. No. Diet with less than not 100 milligram, but it is 200 milligram. Cholesterol up to 200 is okay. And diet including 80 gram dietary fiber daily. It is not 80, but as per what is given, what I'm telling you is the ICMR guideline regarding the non-pharmacological management of diabetes. That means uncomplicated diabetes. It is 40 milligram. Okay, this is for a uncomplicated case of diabetes. It's an uncomplicated case of diabetes mellitus, right? Okay. So here we have two answers, A and B. A is correct and B is also correct. Okay. Suppose, what will you advise? Okay, they have asked for which all are correct. A and B are correct. Suppose there was complication. Now comes the next question. This is about uncomplicated. Now let's expect that they can even ask about complicated. If it is complicated, then sodium requirement will come down. It should be less than 1000 to, or should be kept between 1000 to 2000 milligram. Single best answer. That is among A and B. Then I would say B. Still both are given equal importance. If you ask me, I would say go for B. Okay, go for B. Because both are given as with same importance. Okay. What was I telling actually? If it is a case of complicated, then you have to reduce the sodium intake to between 1000 to 2000 milligram. You have to keep it between 1000 to 2000 milligram. And another thing is protein should be 0. Now I'm coming to complicated. Okay, complicated. If it is a case of complicated diabetes mellitus, then sodium should be kept between 1 gram to 2 gram. Then protein, next MCQ, protein should be less than 0.6 gram per kilogram body weight. Okay, and sodium also, potassium also should be kept less. Was it 35? It wasn't 30. Was it 35? Okay, if it was 35, then we can definitely pick B as the answer. Okay, was it 35? Okay, then I'll change it to 35. Then the correct answer is B. Let's move on to, no, it was 30 only. Come on. You come to a consensus first. Anyway, so keep those points in your minds. Next is regarding doctor-patient relationship. You know, in NMC, they are giving a lot of importance to doctor-patient relationship. They are asking students in NMC, they are clearly asking students, that means they are clearly asking us faculty to give constant training on doctor-patient relationship. And see, we have a question from doctor-patient relationship here. India is a diverse, even without thinking twice, you can answer. India is a diverse country with wealth of various cultures and languages. Which of the following is correct? You can tell me. Which of the following is correct? Is it A, B, C, or D? Physician must emphasize on communication. Yes, physician must emphasize on communication. Communication is very, very important, right? This is something most of us lack. Physician must emphasize on communication. That is very important because you are going to see people from various cultures. So you should be able to communicate to them correctly in a proper way. Give due emphasis on patient's cultural extent. Again, very, very important. You have to always consider the culture before giving any treatment. Suppose there is a patient who is coming with some nutrient deficiency, and you are asking that patient, you have to take non-veg every day. What if that person is coming from a background where their culture don't allow non-veg? So you have to understand that, and you have to give them an alternative according to their culture. So communication is important, as well as understanding their culture is important. Leave communication to the interpreter. No, never do that. You have to do the work. And treat patient regardless of the patient's perception. Patient's perception is also very, very important. So we have A and B. I think I don't have to waste my time on this. You all would have got it correct. Yes, AB. Good, good. Very good. Which of the following is a disinfectant but not a sanitizer? Which one? Which of the following is a disinfectant? That is a question. Correct, 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 Raja. You're right. Penicillin, antibiotic. Okay, this is an antibiotic. Methyl parabenzene. What is it? This is a solvent. This is a solvent. If any of the girls are watching this, your nail polish remover, there one of the solvent is methyl parabenzene. Okay, so this is a solvent. Nothing to do with what we are discussing. Hydrogen peroxide. What about hydrogen peroxide? It is a, what is it? It is a it is an antiseptic. It is an antiseptic. Whereas bleaching powder is a disinfectant. What, by the way, what is the difference between antiseptic and disinfectant? What is the difference? See, antiseptic you apply on human skin, whereas that means on living body. Whereas disinfectant you apply on non-living things. So bleaching powder, you don't apply bleaching powder on your body, right? Whereas antiseptic you apply. So hydrogen peroxide is an antiseptic. So we have only one answer. Here the answer is D. So, okay, all of you have answered it correct. Very good. And next question. What is the time now? Okay, it's 9. I said I'll stop by 9. We have 25 and 26. I hope you don't mind if I take some 5 more minutes, right? Okay. This is a big question, a lengthy question, but simple. Mrs. Rama Devi has 2 children, Ram and Shyam. Like you see in movies, right? Ram and Shyam. Ram is 5-year-old and Shyam is 3-year-old. Shyam developed a fever followed by rash one fine morning, which she thought was due to some allergic rash, and she ignored. Ma'am, do one more session for FMG exam. Sure, I'll be doing it. Definitely, I'll do it, Money. So Ram is 5. What was I saying? Yeah, Shyam developed a fever followed by a rash one fine morning, which she thought was due to some allergic rash. After 3 days, Ram also developed similar rash and symptoms, which worried her and made her take her children to sub-center. Identify the correct statement. I think they are expecting more than one correct statement. Ram is the index case. Sham is the primary case. By the way, what is the difference between index case and primary case? These are very important. Primary case is the first case. Index case is also the first case. Then what is the difference? Anyone? You can unmute and tell me. What is the difference? See, primary case is the very first case which happened. Now, the problem with primary case is it may sometimes go unnoticed. Whereas index case is the very first case which was noticed by everyone or which came into the notice of the system or which was detected by the doctor or by the health system. Is it clear? Now, please look at me. Index finger. Look at index finger. As the name indicates, index finger. What is the use of index finger? To show something, right? So that people can see. So index case is the first one that was noticed by the system, which was noticed by the system. System means health system or by the doctor. Whereas primary means first case, very first case. Now let's see. Ram is the index case. What do you think? And Sham is the primary case. See, this first happened in Sham, right? Sham developed the disease first, followed by Ram. So Sham is the primary case. That is correct. Sham is the primary case. And what about, do you think Ram is the index case? Both were taken to the hospital together. So naturally, the doctor will ask, right? Who developed the disease first? And the mother will say, means Sham developed the disease first. So naturally, the doctor will write only Sham as the index case. Am I clear? It's not the case that was noticed by the mother. Please listen. It is not the case that was noticed by the mother. First case that was noticed by the mother, but the first case that was noticed by the health system. That is Sham. So Sham is both index and, I'm unable to write here, index and primary case. Is that clear? So this is wrong. Ram is not the index case. Sham is the index as well as primary case. The first case that developed the disease as well as the first case that was noticed by the health system. Ram got infection from Sham. What do you think? Yeah, Ram got infection from Sham. By the way, which is the disease that we are considering here? Anyone, please? You guys are there, only I can see. Can you tell me which is the disease that we are considering here? Incidence and prevalence. No, I'm not talking about incidence and prevalence. I'm talking about the index case and primary case. Okay. I think I'll tell you. Here, the disease I think they are considering is measles, viral infection with complaints of rash. Measles. Okay. If it is some viral infection, then there is no problem. If it is measles, by the way, what is the incubation period of measles? If it is measles, incubation period is, say, it ranges from 7 days to 10 days, right? So the problem is, if they are mentioning it as measles, then you have to think that they both must have got disease from someone outside. Because in 3 days, that means after Sham developed disease, in 3 days, Ram also developed disease. So that means the second person didn't get the disease from the first person. Both would have got it from someone outside. Okay, but since you said viral infection with some rash, if you're simply considering some rash, then you're right. Ram got the infection from Sham. Okay, so my point is, this 3 days. Was it actually 3 days? Or if they had given some 7 days, and if measles comes to your mind, then it is okay. Because you should also consider the incubation period of the disease. If it is some viral infection, like you said, then it's okay. That means Ram got infection from Sham. That is correct. And did I confuse you? See, if you're keeping measles in your mind, then you may think that incubation period doesn't match here. Because first case developed in 3 days, second case is also developing. Of course, if you consider that, if you think that the person could be infective even before he developed rash, it is 4 days prior to rash, the patient can start giving infection to another person. Again, this 3 days won't work. So I think it wouldn't have been 3 days. It would have been some 7 days in the question. I'm not sure. Anyway, the question that I got from the student was 3 days. Anyway, I just wanted to, I was trying to give you a, I was trying to make you think in terms of incubation period as well. So we should always consider the incubation period. So here, Ram must have got infection from Sham because it is some disease with rash. Then it is okay. Post-exposure prophylaxis would have been effective if done immediately. This applies only if we are talking about measles. And in measles, what is a post-exposure prophylaxis? Is there any post-exposure prophylaxis? It was 3 days only. Sure, it was 3 days only. Okay. Anyway, in measles, we have 2 post-exposure prophylaxis available, right? Which are they? One is vaccine. You can give measles vaccine. It should be given, that next MCQ is within 3 days of exposure. Within 3 days of exposure. And the second post-exposure prophylaxis is, first is vaccine. Second is immunoglobulin, which can be given within 6 days of exposure. Both these are MCQs. So if you're considering measles here, yes, these also correct. Post-exposure prophylaxis would have worked if she had taken the first child to the hospital. If they had diagnosed it as measles, then immediately doctor would have given the vaccine or immunoglobulin to the second child, and thus she could have prevented the second attack. So in this particular question, the answer is, correct answers are B, C, and D. Am I clear? I think I might have little bit made you, little bit confused. You might have gone a little bit confused. What I wanted to tell you is, if you're considering straight away measles here, the 3 day is little bit confusing. Okay, that is the only thing I said. Had it been 7, then without any doubt, we could have said C, B, C, and D are correct. This is the last question. Be with me. Last question. Paracetamol 500 milligram is written on the label. A government analyst found out that it contained only 200 milligram of drug. Quite possible, especially if this is in a government hospital. As per Drugs and Cosmetic Act 1940, this is an example 4. Spurious drug, misbranded drug, adulterated drug, unethical drug. Answer the last question. We can finish off. What is the answer? So let's see here. No. Not adulterated. No, not adulterated. All of you saying adulterated. No. See, there are some, this is from the chapter. This is a new chapter. Unethical. Come on, nobody is correctly answering. See, this is from the chapter, Essential Drugs and Counterfeit Drugs. Spurious. You answered everything except the correct answer. Now only one more left. Which one? Misbranded. This is misbranded actually. I'll tell you what it is. You should be familiar with few definitions when it comes to counterfeit drug. First one is, what do you mean by counterfeit drug? Counterfeit drug means a drug which they are selling with the intention to cheat. So all those things, spurious, misbranded, adulterated, all those are coming under counterfeit drug. All these are coming under the broader definition of counterfeit. That means a drug that is made with the intention to cheat. Spurious. Misbranded was not in the option. Misbranded was not there in the option, sure. Then what was the correct answer there? No. Spurious is something different. You know what is spurious? What is the word meaning? Spurious is also known as imitation drug. imitation drug. Okay, imitation means, spurious means it is a drug they are manufacturing, concealing the true identity of the product and made to resemble another drug, especially of some popular brand. That means counterfeit was an option. Then you can definitely go for counterfeit. If counterfeit was one of the options, okay, let me go back. Sorry, this was not there. It is counterfeit. Then you can go for counterfeit. Okay. What was I saying? Spurious means confusing. For example, that means you are trying to make the name to such a way that people may feel that this is some other drug, some popular drug. Okay, for example, some very simple example. See, after this COVID, each and every person, small, big, everyone is familiar with the term Dolo. I'm not going to promote Dolo. I'm just telling you, everybody is going to the hospital. I mean, they go to pharmacy and they're asking for, whenever they develop fever, they're asking for Dolo. So everyone knows about Dolo. So now Dolo is a very, very, very popular drug. Paracetamol. Nobody's asking for paracetamol, Dolo. So some other company, seeing that this has become really popular, they are making another drug with a spurious name, like say DOOLO. That is also pronounced as Dolo only, right? So they're asking, someone is asking for Dolo and they are giving this drug. This is spurious or imitation drug. That means they are trying to conceal the true identity and made to resemble another drug, especially some popular brand. That is spurious. Whereas misbranded has many definitions, but as per this one, if the label, that means branding is not correct. In brand, they have said 500. Label does not contain actual quantity of the content in terms of the weight, measure, or numerical count. This is one of the criteria for misbranded drug. Okay, so if misbranded was there, then I would have gone for misbranded only. Is it clear? Look like a trade name. Yes, exactly. Okay, I was just trying to give you an example, what it means. Imitation drug. Not only in drug, in many places we have it. Okay, there is a popular brand, then people make something slightly similar to that, but not up to that standard. So people feel like, oh, both are the same. Same happens in drug. That is curious. Okay, so thank God, we have come to the end of our session. I'm so happy to see that all those who joined have been there with me till the end. So happy. And I hope the session was useful. So how was the session? Was it useful? I hope it was useful. I don't want to take much of your time. Thank you very much once again. Good night. All the best. And please let me know your results once they are out. Okay. Bye.